Okay, we're going to talk a little bit about back pain today. Back pain is a very common ailment that affects many people in the United States. Some causes of back pain are related to work injuries or automobile accidents, and sometimes people have back pain that just comes on over time and gradually gets worse. Back pain has many causes. Back pain is most commonly due to problems with the joints in the spine. And those joints include the disc, which is a washer between bones in the spine, this structure here, or the facet joints, which are in the back of the spine. The spine has 26 movable bones, and between the bones there has to be a washer. That washer is the disc. In the back of the spine there are two other joints called the facet joints, and the facet joints help stabilize the spine with movement. Movement that occurs in the spine occurs at the level of the disc and at the facet joints. Problems with the disc or the facet joints can cause pain, such as back pain or neck pain. At the Deuk Spine Institute, we treat back and neck pain. The disc itself can be injured in any number of ways, and damage to the disc can be very painful. Injuries to the disc don't have to be large to be painful. Some patients have very small tears in the outer part of the disc called an annular tear or disc rupture, which can be exceptionally painful. On the other hand, other patients have large disc herniations which don't cause any symptoms whatsoever. We treat patients who have damaged discs with symptoms. If you have no symptoms, we don't do any treatment. The common symptoms that occur with injuries to the joints in the spine include back pain, leg pain, sciatica, numbness in the legs or feet, tingling such as pins and needles in the legs and feet. Any of these symptoms can indicate a problem with the disc in the back or the facet joints. In the neck, patients have similar problems related to the discs. For example, an injured disc in the neck can actually cause headaches, neck pain, arm pain or shoulder pain, numbness and tingling in the fingers. These symptoms will persist in most patients until they're treated effectively. At the Deuk Spine Institute, we've developed new ways of treating discogenic pain, or pain coming from the discs, and pain coming from the facets. We use state-of-the-art lasers, which are extremely accurate and precise, to come in and repair the disc rather than sacrifice the disc. Most spine surgeons will try to tell you that you need a fusion surgery to fix your back pain. Fusion surgeries are an older technique for treating back pain that are very common. Fusion surgery involves using some form of internal fixation, such as screws and rods, to help stabilize the injured part of the spine. Most fusion surgeries, in my opinion, are unnecessary and shouldn't be performed. Though the disc itself cannot repair itself in patients with chronic back pain, we can help you repair your disc with the use of lasers and endoscopic spine surgery. In contrast to the Deuk laser disc repair, which requires an incision the size of a dime, most open surgeries that are done in hospitals by spine surgeons require much larger incisions, sometimes several inches in length. The smallest surgical incisions that can be done through the traditional tubular retractor systems are generally 3 times larger than a Deuk laser disc repair incision. These larger incisions mean more muscle damage and more tissue damage related to the surgery. To minimize tissue damage, we use the smallest incision possible, and we gently dilate the muscles out of the way to gain access to the damaged disc so we can repair it. Disc repair involves removing damaged tissue within the disc with the use of a laser and mechanical forceps. These are very gentle techniques for treating a damaged disc and cause almost no collateral damage to the spine. The problem with traditional spine surgery is that there is collateral damage to the spine that occurs with the surgical approach. The surgical approach is essentially the way the surgeon gets to the spine to treat the damaged disc. Most commonly, the surgeons have to remove part of the bony spine in the back, called a laminotomy or laminectomy, and remove part of the facet joint, which we've already talked about. The facet joint is a bony structure that stabilizes the spine and keeps it from moving too much. It's that extra movement of the spine that actually causes pain over time and can cause the need for a fusion surgery. By not removing the facet joint and keeping the natural joints of the spine the way they were supposed to be without damaging them, we actually preserve the integrity of that area of the spine where the damaged disc is, thus obviating the need for any additional treatment in the future. The Deuk laser disc repair is a very safe surgery. The complication rate is less than 1%. Patient satisfaction is over 98% for the surgery for treatment of back pain and leg symptoms. Regarding the cervical discs, or discs in the neck that can be damaged, our success rate is also over 95%, treating headaches that are related to herniated discs, as well as neck and arm symptoms such as pain in the neck, pain in the arm, numbness and tingling in the hands, respond in about 95% of patients who have the Deuk cervical laser disc repair done. This is also done with the laser. In the cervical spine, in the neck region, the most common treatment for a herniated disc involves removing the entire disc and fusing the bones together with a spacer and a metal plate and screws. With the Deuk laser disc repair, there is no metal plate, there is no fusion. It's all done through a 4mm incision, and patients go home 30 minutes after the surgery. You can be back to work within 3 days. You can be back to normal activities the next day after the surgery. There is again no need for fusion. There is no need for artificial discs made out of metal and plastic. There is no need for metal plates and screws. You can maintain normal movement in your neck after the surgery. The surgery is designed to repair herniated discs and bulging discs in the neck.